Public Health Impact. I'm Phaedra Corso.
And I'm Cham Dallas. The topic of today's show is one that should be of interest to all of us since we're all going to get there, and that is, we've heard that the big issue of the day is that population is aging.
That's right, Cham. The World Health Organization, or WHO, indicates that our world population is aging at a truly unprecedented rate.
And this is a result of a longer life expectancy, but also declining fertility rates all across the globe.
And while this is a celebration that we are living longer, it presents unique challenges for us as we try to figure out what to do with this changing demographic.
Yeah, it's estimated that between 2000 and 2050, the proportion of the world's population aged 60 years and older, and I'm approaching that demographic myself, that's going to double from 11% up to 22%.
And what that means in real numbers is that more than 1/5 of our entire world population will be over the age of 60.
Yeah, put another way, 1 in 5 people will be over 60 years old. The actual number is anticipated to go from 605 million to 2 billion people over 60 by 2050.
So to help us think about how we're going to deal with this aging population, we've got 3 experts that are coming to talk to us today from the Institute of Gerontology in the College of Public Health.
Joining us a little later in the show will be Dr. Toni Miles, the director of the Institute of Gerontology, Dr. Kirsten Gerst, an assistant professor in the Institute, and Dr. Ann Glass, who's associate professor and the graduate coordinator in the Institute of Gerontology.
So stay with us on PHI, Public Health Impact, as we talk about this very important topic of aging. With me now is Dr. Toni Miles. She is the director of the Institute of Gerontology here in the College of Public Health. Thank you, Toni, for being here today.
Thank you.
And my first question for you has to do with this topic of the show today, which is gerontology. I know there's another word, geriatrics. What is the difference between gerontology and geriatrics?
Thank you for starting out with that question, because a lot of people confuse the two. Basically, geriatrics is just the care of older, mostly frail adults. Gerontology is everything else: lifestyle, finances, everything that happens during that part of the life cycle, like pediatrics, only after 50, basically.
And so how important is the field of gerontology now?
We as a culture have been so successful in getting people through all those other stages of life. So gerontology is primo, and it influences everything that's going on in society.
So let's get into some more detail about this phenomena of population aging. What has caused this to come about?
We've done a better job with public health, basically. We have clean water, we get women through childbirth, we get people through injuries and illnesses that might have taken them out earlier in life. And so we are fortunate now that a lot of people are not only aging, but they're arriving at that stage of life in better health.
And what are some of the implications of having more people in that older age group?
Well, it has everywhere. It has implications for housing and finance and how we think about our work life. People are going to have to think in terms of longer careers. We're going to have to change the way we educate ourselves. Everything is up for renegotiation.
And what are some of the consequences or some of the actions that are being taken either at the national level or the international level? Because I know that this aging population is not a U.S. phenomenon, right?
Yes, it's global. It's global. The only place where aging is not happening is probably sub-Saharan Africa, because of the drought and famine and all that other stuff. But everywhere else, Europe, in Asia, in China, for example, there are 300 million people who are over 65 alive today. So every country is having to think about how their society needs to be restructured with this older adult population.
And so what are we doing here in the U.S.?
Well, the debate you hear on the news about retirement age and eligibility for Medicare and who's going to pay for the things that come along with an older population. All of that is part of the national conversation about adapting to that.
And how about some of the steps that we're taking here in Georgia?
Amazing stuff is going on. The governor has convened a task force to develop a state plan to address the growth, unfortunately, in a number of people who have dementing illnesses. So that influences driving and housing and health care, but he's being proactive about it, which is a very good thing.
You're a new director of this institute,
Yes.
and I think this field of gerontology is so interesting. I'd like to know kind of what is your background and how did you get interested in the field?
My first project in gerontology was when I was in medical school. And I worked in a high rise of African American seniors, and I went in and I did body composition, skin fold thickness, and blood pressure measurements, and I had a ball doing that. It was supported by the National Council on Aging, and I must have been about 28 at the time. And so I've since then gone through medical school. I have a PhD in neuroscience and studied cognitive issues, and then I've gone on to do more training in public health. So that's where I am now.
And as the new director, what are some of your plans for your institute?
We're now working to infuse gerontologic expertise into public health training. So that's the educational agenda, but the research, my own research agenda, focuses on the public health impact of mortality in an aging society. We've been really focused on preventing mortality and keeping old people well. What we haven't really gotten a handle on, which I think is really important, is what their passing does to the health and well-being of people who are left behind.
The survivors.
Yes, and so as adults, we live with our parents 30, 40, 50 years, and that has real impact on our own health. So I've got a number of people I'm now starting to engage with on papers in that area, and because it's important.
Right. My last question for you is, this is a hypothetical.
Okay.
Imagine that you were the National Gerontology Advisor. What would be your recommendations to the president in how he can deal with this growing aging population?
Everything you plan, if I were sitting at his ear, everything you think about, everything you do has an aging dimension to it. You might not think it does, but it does. The restructuring of the VA for the returning troops from Afghanistan has an aging dimension to it because the VA serves a big aging population.
Right.
Our transportation spending, Ray LaHood is his Secretary of Transportation, there's a big aging dimension to that. We've got to accommodate people who can't or do not want to drive. So every policy he's going to come up with, I'm going to give him the aging dimension of that.
Great. Well, thanks so much for joining us today.
Thank you.
With us now is Dr. Kirsten Gerst, who is an assistant professor in the Institute of Gerontology. Thank you so much for being here, Kirsten.
Thank you for having me.
We're talking about gerontology today. How did you get interested in this field?
I volunteered in a nursing home when I was in middle school and high school, and I loved it. I loved being around the older adults. I enjoyed the entire experience, and I had a very great professor in my undergraduate who told me that there was actually an entire discipline called gerontology, and I got a master's in gerontology and then a PhD in gerontology, and I never looked back. It's been
Great,
wonderful.
that's wonderful. And so you're here now at the University of Georgia and you're doing some teaching. Why don't you tell me a little bit about what your plans are in that area?
Well, I love the teaching. It's one of my big passions because I got so excited by it as an undergraduate. I want to pass that on to others, and up until I came to UGA a year and a half ago, we never had an undergraduate program. And so we're starting slowly. I'm doing one class right now in the undergraduate, and it's called Introduction to Gerontology, or Aspects of Aging. And just trying to get undergraduates interested in the idea, knowing that there's this discipline out there and realizing that in their future it's going to become very important to know about aging. And so it's kind of a broad public health overview of everything that you probably should know about the aging world.
So the field of gerontology is very wide. It seems like you could pick anything and it would qualify for gerontology. So what are you doing specifically?
And that's what's exciting about gerontology. You can really go into a number of things within the field, but what I'm really excited about is diversity in aging. So we often talk about this aging country or the aging world, and we don't think that there's pretty great diversity in any population, but especially within aging. And so aging for predominantly white groups is very different from aging for blacks or Hispanic elders. And so I focus on that diversity that's going on within the aging population.
And I like that you're focusing on the Hispanic population. Can you tell me a little bit more about what you're doing there?
Yes, my major focus is on Hispanics because there's a lot of them now, but if you look at projections, there's going to be even more. One of the projections I just read is that there will be almost 20 million older Hispanics by 2050, and that's a lot. And they have kind of a unique demographic profile, and so it's interesting to look at, as well as the fact that there are a large proportion of immigrants in the United States. So because Mexico is so close to the United States, we have immigrants who come to the United States as older adults, but who also go back and forth between their country. And so I look a lot at Mexican American aging in the United States specifically.
And can you tell me some examples of how aging in the Hispanic population might be different than some of the other race ethnicity groups?
Well, one of the most exciting things in the research right now is we talk about something called the Hispanic paradox, which is looking at the fact that older Hispanics have kind of a low socioeconomic status profile. They have lower education, lower income on average, and all of our research shows us that if you have low education, low income, you live less years, so you have a higher mortality. But for Hispanics, it actually doesn't happen. They live as long, if not longer, than whites. And
Is it
that's
due to their
considered a
diet?
paradox. That's actually a very good guess. We don't know exactly what it's due to. One of our guesses is health behaviors. So if they're eating healthier foods, if maybe they're exercising more, smoking less, drinking less, that could help with their longevity. We also think that there might be something of a return migration going on. So maybe Mexican Americans especially tend to come to the United States in middle ages to work, and maybe they go back home to Mexico when they're sick and they go back to die. So the healthiest people that we have are the ones who are alive and healthy here. So we don't see them when they die because they might go back to Mexico. We call that the salmon effect. And that might explain part of it. And kind of the flip side of that is the only ones who are immigrating to the United States are the healthiest people. You're not going to get the sickest people who are having mental health or physical health issues. You're going to get kind of robust, healthy people that are immigrating. And so that's called the immigrant effect, which we think is contributing a great deal to the Hispanic paradox.
Could it also be that the family structure is different in Hispanic populations, and that might be, impacting their care that they're getting from?
Yes, quite a bit, and that's one of the things I'm interested in looking at is that social support that's happening. Hispanics tend to live in predominantly Hispanic neighborhoods, so Mexican Americans tend to live with all their neighbors who are Mexican American and family members as well. And there's that natural social support that happens in neighborhoods. So you have people that speak your same language, people who can help you guide through all sorts of things, grocery stores that cater to your food preferences. And so it's really beneficial for these people to live in these neighborhoods, and we think that's helping them with their longevity.
Great. Well, thanks so much.
Thank you very much.
Joining us now is Dr. Ann Glass, who is the Associate Director and Graduate Coordinator of the Institute of Gerontology, and also an Associate Professor in Department of Health Policy and Management. Ann, thanks so much for being here today.
It's great to be here.
I asked the same question to Dr. Miles and Dr. Gerst, and that is, how did you become interested in gerontology?
Well, I actually attribute it to my great Aunt Betty, who lived to be 105 years old, and even when she was in a nursing home toward the end of her life, she was the kind of person who stayed interested in life, and every time you visited her, she was like, "Oh, you just look so pretty today," and she just gave me, I think, a really good feeling about how aging can be.
So one of the first things I want to talk to you about is the Student Mentoring Conference that we'll be taking a look at in a few minutes. I know you're one of the main organizers of that conference. Can you give us a few more details about it?
Yeah, it's a great conference. It got started here at UGA. We just had our 23rd annual conference, so we've kept it going, and it's grown over this period of years. We have several co-sponsoring schools now, not only Georgia State, Armstrong Atlantic, and Mercer University within Georgia, but also the University of South Florida, Kentucky, and Alabama are co-sponsors now. And this year we had 45 student abstracts were submitted, and we probably had 100 people in attendance, and that's a good size for us. And we've talked about making it larger, but we really like to have that kind of intimate feeling to it, and the whole point of it is to give the students an opportunity to present in a non-threatening environment. And for some of them, it's the first time they've ever done any public speaking, so it's a good opportunity for them.
Wonderful. Well, we talked to a few students at the conference, so let's take a look at that now.
I'm here with Ashlyn Jackson. She's an MPH student in Health Policy and Management. Ashlyn, tell me about your poster, Ashlyn.
Yes, my poster is actually covering my internship experience in the fall. I had the pleasure of interning with the Georgia Council on Aging. Throughout my internship, I actually worked on a primary public policy issue concerning the personal needs allowance, the allowed amount of money that they can keep each month to purchase personal items that we often take for granted.
Okay, so tell me, what was your role specifically around this policy?
Well, my task was to actually research the history of the personal needs allowance here in Georgia, and I found some great facts. That issue actually, the personal needs allowance was set at $30, and it was actually raised to $50 in 2006, but it has remained at $50 since then.
So did you come up with a new policy recommendation based on your research?
Well, what I worked with the council, they actually came up with a recommendation, but I did the background research so they could take that evidence and propose a solution.
And what are your plans after you graduate?
Well, I want to actually be an advocate, so I'm looking at possibly working with other state agencies, and I'm actually interning right now with AARP. So I'm looking at definitely the advocacy side of working with older adults in the community.
Awesome, congratulations.
Thank you.
I'm now with Brian Hentz, and I see that you're from University of Connecticut. How is it that we're interviewing you on a UGA TV show?
Yes, I traveled a bit away to come here. In 2010 and 11, I completed the graduate certificate in gerontology from University of Georgia's Institute of Gerontology. And it was a very wonderful experience for me because all the work that I've done here now feeds into the doctoral work that I'm doing up at the University of Connecticut in adult learning.
Okay, and your poster looks fantastic. Tell me a little bit about what you're presenting here.
Sure. I come from the discipline of professional writing and communication, and I teach in the School of Business. And one of the things that I've discovered about aging is I find that lots of individuals in fields like social work, very interested, public health, those types of things. And I always seemed like I was on the outside looking in. I'm from the School of Business, and what I'm trying to promote is aging literacy across not only the School of Business, but really across lots of different disciplines, because I think it all matters to all of us. And so what I'm trying to do in my classrooms in professional writing is get my students engaged about talking about aging issues, because it's going to impact all of us one way or the other.
That's awesome. You're showing how gerontology touches all of us and not just public health, so I really like that. So can you tell me specifically about what you're presenting here?
Sure. The way that I framed aging issues in my classroom was I developed a model called aging literacy. And so what I did, there's a few strands attached to it. I had us talk in my classroom about representational issues. In other words, what language do we use to refer to older adults? And what I found is that a lot of my students had never thought about these things because they had never been introduced to them before. So even though I'm working with students like accountants and finance majors and those types of individuals, it really matters in terms of the products that they'll be producing and the clients with whom they'll be working in the future. Other things that we will talk about is how the life course is changing and how that's going to affect workplace dynamics as well. So testimonies, I would look at surveys at the end of my course and saying, how is this playing? You haven't discussed these types of things in your courses before, and I found out that students have been really receptive. And in terms of implications, what I've discovered is that we really need, and I look forward to creating more synergies between schools of business and gerontology programs.
Excellent. We're trying to do the same here too, so thank you.
Thank you.
I'm here with Francesca Iannaccone, and you are an MPH student in health promotion and behavior, is that right?
That's correct.
Okay, your poster looks wonderful, Public Health and Aging in Taiwan. Tell me a little bit about what the poster's all about.
Well, this was actually my internship last May. It's called Public Health and Aging in Taiwan. We got the chance to go to Taiwan for 3 weeks. We took classes at Kaohsiung Medical University. We took field trips. We participated in all kinds of traditional activities. We did tea ceremonies, and we also focused on older adults and the systems they have in place for them.
So is your poster, is it just describing your experience while you were in Taiwan?
Yes, it's explaining what we did, things that we learned. We learned about cultural views and attitudes towards death and aging. We learned about their healthcare system, which includes traditional Chinese medicine, as well as their national health insurance program, which is a single-payer health insurance program that the government started in 1995, as well as where they're looking to go in the future.
And so you're getting the certificate in gerontology, and you're getting an MPH in health promotion and behavior, which is an interesting combination. What are your plans after you graduate?
Well, I'm actually going to be doing an internship in Washington, D.C. with the Older Women's League. They're an advocacy group, and I'm looking to promote older women's health and also keeping with the health promotion, looking towards the intervention and program part of it as well.
That's wonderful. Congratulations and good luck to you.
Thank you.
We're now here with our very own Liz Wilson, who is part of our production crew. Liz, tell us about your poster.
Okay, well, my poster showcases part of my internship that I did in St. Lucia, and it's a study on attitudes to aging among healthcare providers in St. Lucia.
And St. Lucia, you chose that country for what reason?
Well, because it's my home country, that's one, and two, because it's a developing country, and there's been not a lot of studies done on aging in developing countries, so I thought it was interesting to do that.
Okay, and tell me, this is part of your internship project. What exactly did you do while you were during your internship?
Okay, well, I'm doing at UGA the Masters in Public Health, also a certificate in Global Health and a certificate in Gerontology. So my internship was threefold, so I did 3 different things, and this particular one was a study among 4 healthcare institutions in St. Lucia looking at aging or attitudes to aging among the healthcare providers, and that was important because the aging is going at an unprecedented rate, especially in developing countries, because it's just going faster, the pace. And so ageism, which is discrimination really against older people just based on their age, has been shown to be rampant in healthcare. So what that means is that because the developing countries are going to have less time and fewer resources to deal with the issues of aging, that it would be a good thing to look at the ageism and see how that needs to be dealt with first.
So you represent one of our very few students that have done dual certificates, so it's quite interesting to see that one can do that. I know you're graduating this May. What are your plans for after graduation?
Well, after graduation, I am actually staying on at the University of Georgia and pursuing a PhD in health promotion and behavior, so I'm excited about that.
Are you going to stick within the gerontology focus?
I will be looking at chronic disease and aging in developing countries. That will be my focus, so it will be global health and gerontology as well.
And one of the great things that the Institute of Gerontology has been doing for a long time is the certificate in gerontology. Could you tell us a little bit more about that?
UGA was one of the early entrants into the gerontology field. We've had the certificate program for over 35 years, so we're not a fly-by-night operation. The first 3 certificate completers were back in 1976. And since then, we've had over 325 students who've completed it, including myself several years ago. So it was a real pleasure to be able to come back to UGA as the graduate coordinator of the program.
And what are some of the basic requirements of the certificate? That's one question. And the other question is, can anyone get this certificate, or do you have to be part of the School of Public Health?
No, traditionally it's open to any graduate student at UGA. They can do it at the same time they're doing a master's degree or a doctoral degree. And we also have made it possible for honors undergraduate students to enroll, as well as people in the community. The non-traditional students, people who are working, can come back and do the certificate only. They don't have to be working on a graduate degree.
And what does one do with a certificate? Does it help people get a job, or is it a qualification necessary for certain occupations?
It is recognized as an academic achievement. It goes on their transcript, and it shows that they have some extra expertise in working with an older population and understanding the needs of the older population. And an example is one of our students is a physical therapist, and she was used to thinking of people as a knee replacement. And after she had the certificate training, she started to look at it more comprehensively. So she would think about the patient, but she would think about what was the home situation the person was going to, what was the family support, what was going on, cognitively, were they understanding what she was teaching them. So she looked at it much more holistically. So that's part of what's great about gerontology, I think, is it is interdisciplinary.
And you've been in the field, the gerontology field, for quite a while. This next question is kind of a hypothetical one, but if you could mandate that every person in the U.S. Carried out one action to prepare themselves for aging, either for themselves or for their loved ones, what would you have them do?
Well, I'd actually have them I'd have them watch this, Aging 101 for Georgia.
All right, tell us about it.
This was something that we put together. The idea was exactly what you said. If I had somebody for an hour, what is the most important information I'd want to get into their head? And when we did the DVD, it actually took an hour and a half to get it all in there. But it's available free through the Institute, and it's in the public libraries across the state. We had funding to make it available free. And it's also accessible on the web through YouTube, so anybody can watch it, and there's quite a bit of good information.
So what kinds of information are in the video?
Well, we talk about nutrition and exercise, the kind of things you can do to help you age well, because we know that about 70% of your longevity is actually due to lifestyle, is the best estimate right now. So lifestyle choices are important. We also talk about caregiving, medications, adjusting to change, and so forth, a lot of the issues that older people have. One of the strengths of the video, I think, is that we have a lot of older people in the video sharing their wisdom and insight, and I think that's what makes it really, really valuable. So I would recommend they watch that.
Well, great. Thank you so much, Ann.
Thank you.
Well, this episode of PHI has really opened my eyes as we've gotten this very interesting glimpse into our future.
And we know that living longer is a wonderful thing, but our guest showed us that that's not the only thing we should be caring about.
Yeah, well, the key for us is to live longer, healthier lives, and we can all assume some personal responsibility for this aspect of aging.
And at the other end of the spectrum, there needs to be some national efforts to get us prepared for this changing demographic.
Well, one thing is for certain is our lives are going to change, and we better be ready to adapt to this one.
So we'd like to thank our guests for joining us today, and you as well, on PHI Public Health Impact, as we've talked about the very important topic of aging.